Prevention measures efficacy on HAPU in emergency patients. Emergency patients often spend long periods resting in a single position, which potentially causes hospital-acquired pressure ulcers. Research shows that the condition affects surgical patients more than other patient categories. Therefore, it is often associated with immobility and maintaining a single rest position, thus blocking essential blood vessels. This eventually causes pressure buildup and possible rupturing of blood vessels, causing hospital-acquired pressure ulcers, HAPU. This research aims to examine the impact of prevention intervention practices on the condition's prevalence among emergency patients. The research involves an experiment by dividing patients in an emergency room into two groups, a subject group, exposed to prevention interventions, and a control group, not exposed to prevention interventions. The resulting impacts of patient intervention are determined by comparing the data on HAPU rate between the two sample groups. PICO question. In emergency department patients, P, does the HAPU prevention intervention, I, as compared to usual care, C, reduces its incidence, O, on the third day of patient stay, T? Discussion of pilot project. This research aims to evaluate the impacts of prevention intervention measures of HAPU on emergency patients. The approach utilizes support surfaces, more frequent repositioning of patients, and an integrated skin examination. These intervention measures aim to prevent and examine possible causes of HAPU. The study also identifies patients in vulnerable conditions and provides measures for more frequent care among this population. For instance, patients in complete immobility are repositioned every 2 hours, while those with limited mobility are repositioned less frequently. Additionally, patients at a higher risk of pressure-related conditions are provided with frequent care compared to those with no pressure-related conditions due to the predisposition to HAPU. Additionally, patient care promoted the integration of several techniques to improve the efficiency of the process. For instance, nurses can apply the skin examination, use support surfaces, and reposition patients in a single patient's treatment plan. Supporting evidence. The approach to the research includes randomly grouping patients in an emergency setup into two groups, the prevention intervention group and the control group. The control group comprises patients undergoing usual routines without new intervention measures. The patients in this category receive the usual treatment plan. The two groups are randomly selected without any criteria. As such, the research results rely on chance and are reliable in proving or disapproving the hypothesis that prevention intervention measures reduce HAPU cases in emergency rooms. Although the prevention intervention measures aim to improve quality of life and health, ethical standards must be met when dealing with human subjects. Ethical guidelines include informing the test patients of the issues involved, and the benefits and possible negative impacts of the research. After the introduction or unfreezing phase, necessary training will be required to equip nurses with the necessary skills and knowledge. Other activities involved include hiring personnel and patient care provision with respect to the categories. The major stakeholders of the prevention intervention will include nurses and emergency patients. All patients will be included in the research as long as they provide consent. Implications for practice. Emergency patients are often exposed to secondary conditions that may result from hospital practices or lack of practice. HAPU may develop after the admission of a patient, thus increasing treatment time, cost, and complexity. Prevention interventions will ensure fewer cases are reported since frequent repositioning of patients ensures that blockage of blood vessels is easily avoided. Additionally, physical examination of their skin ensures a proper monitoring system. These measures prevent patients from HAPU and thus improve the quality of health.